how do you use FAMs when you're postpartum? Well, first of all, let's talk about a few key considerations. So, how soon does your fertility return after you give birth? Well, the answer is it depends. The main factor that influences the return of ovulation once you give birth is whether or not you're breastfeeding. And when I say breastfeeding here, I'm talking breastfeeding 100% of the time. So this means you're breastfeeding your baby on demand. You're not bottling your breast milk, so no bottles, no pumping. You're soothing and feeding your baby by offering your breast only. And also, lastly, importantly, menstruation hasn't yet returned. So if you're 100% breastfeeding, meeting these criteria, then you're able to assume that you're infertile for the first 56 days after you give birth, first 56 days postpartum. If you're not breastfeeding, then ovulation typically resumes within 6 weeks of giving birth. So that's roughly 42 days, right? 6 times 7, 42 days. While lactational amenorrhea method, so this is often referred to as LAM, is considered highly efficient, greater than 98.5% effective for spacing out pregnancies, there's no such guarantee if you choose not to breastfeed or if you're not 100% breastfeeding. Whether you're breastfeeding or not, there's a pretty big range for when ovulation returns after you give birth. In women who aren't breastfeeding, the range for when ovulation returned, according to one paper, was from 6 weeks postpartum to 3 months postpartum. In women who are providing 100% breastfeeding to their babe, you may not experience ovulation until you begin weaning your child. And so then the question is, with such a big window, 56 days, that's roughly, math is failing me now. Anyways, from 56 days is a pretty big difference from weaning your child at, say, a year and a half of age, right? Like that's a huge window. So low-key flow. Let's talk about this. So this is what after you give birth, you expect to have some sort of flow for several weeks after giving birth. This is up to 6 or 8 weeks after you give birth, and at the beginning that will be heavier flow, more similar to heavy period days. Then that'll progress into lighter flow, lighter red or pink in color, and typically also lighter inflow. And then finally, that'll transition into a near white flow. So it's lighter still, almost white, translucent in color maybe. Typically, lochia continues for around 30 days postpartum. It's not uncommon to experience lochia for 6 or more weeks. It's important to distinguish lochial flow from menstrual flow. It's been found that when you're breastfeeding and you have a period return within the 56-day window, this cycle is anovulatory. So it's a non-ovulatory cycle as long as you fully breastfeed. This is only true for a return of a period within the 56-day window. After 56 days, use a FEMM use a fertility awareness method other than the lactational amenorrhea method in order to avoid pregnancy. While any fertility awareness method that you were using prior to pregnancy is an option, many women wind up switching to using the Marquette Method during their postpartum phase. And the reason for this is because cervical secretions are often confusing during the postpartum phase. Fertility Friday podcast, Lisa Hendrickson Jack does a great job in one of her episodes in talking about why this is. It's essentially because pregnancy itself revitalizes your reproductive organs. And so after giving birth, a lot of times you'll have more noticeable cervical secretions. Even if you don't have a change in your cervical secretions from pre-pregnancy, what is likely that you'll just have more vaginal secretions. So arousal fluid and that kind of thing postpartum than you did before. So definitely check out that Fertility Friday podcast linked in the references section for more on this. And in short, yeah, pregnancy rejuvenates the tissues in your genitourinary tract. And whether you're breastfeeding or not, this might mean that you observe a shift in your basic infertile pattern. It also means that it's very likely for you to transition in and out of fertile quality cervical secretions, or just have a really hard time of differentiating cervical secretions from arousal fluid during that postpartum period. The other problem after giving birth is that typically you have a disrupted sleep pattern, and this means confirming your ovulation by tracking your body temp upon rising might be confusing. Many women in postpartum consider adding in a wearable device like the temp drop or the Ava Women's bracelet to remove some of that noise from their BBT charts. If your preference is to continue using cervical fluid only or a symptothermal method during postpartum, you'll find postpartum charts available for reference in the charts module of this course. You'll also find a list of practitioners, including Lisa Hendrickson Jack. She's using the Justice method and has used that method postpartum as well successfully. So you'll find her as well as a few other instructors. There's one doctor, so the NFP pharmacist, Emily Kirkwald, she uses the Marquette Method and has done that postpartum as well. So you'll find them listed in the references section. For now, we're going to take a look at the Marquette Method for postpartum.